Wish you were one of those influencers with raving fans who binge on your every word, consume all your content, buy everything you have to sell, and demand even more? Then stay tuned while Authority Magazine columnist and BuzzFeed contributor Tracy Hazard shares strategies, tips, and tactics from top videocasters, podcasters, authors, and social influencers on creating that bingeable factor. Now, let's join Tracy as she explores how to rise above all the digital noise with the binge factor.
Hey everyone, welcome to Feed Your Brand Center of Influence. I'm Tracy Hazard, and I've got a WeGo Health Award Best Show Podcast category nominated podcaster. Wow, that's quite a mouthful. So Diane Daniels has the podcast called Medicare Nation, and you'll find out through the show. She actually has a couple other podcasts too, but she's the CEO of Medicare Nation, and Diane provides superior Medicare education to thousands of senior citizens across the United States. Medicare Nation services also include Medicare plan enrollment and comparisons, health plan strategies, grievances, appeals, the whole nightmare that is our Medicare system. And for anyone who is experiencing that for the first time with their parents or going through it for themselves right now, you really need some help. And Medicare Nation is amazing. I've listened to a few episodes and learned some things myself I didn't know. Diane is recognized nationally as a top expert in Medicare, and she's sought after to collaborate and write articles for the USA Today, Insurance Company, and Grandparents Magazine. Her Medicare Survival Guide was published in 2015 and won the eLiterature Silver Award for a reference book. She's a global consultant and talks to insurance industries around the world. When Diane is not educating and assisting seniors with Medicare, she is living along Florida's beautiful beaches, playing pickleball, board games, and traveling. I am so pleased to have Diane Daniels on and have her energy. And she is another one of our podcasters who's also going to be at She Podcast. So for those of you who are going to go to the event, you have gotten quite a peek at some of the amazing speakers that are going to be there. She's going to be on one of the panels talking about monetization. So I'm super excited to bring you Diane Daniels. Diane, thank you so much for joining me today. I'm so excited to talk podcasting with you.
Tracy, it's a pleasure.
So the Medicare Nation. I mean, who thought that your audience would be on podcasting? Did you get a lot of people go, oh, they're never going to listen?
All of my podcasting friends say nobody listens to my podcast.
They say nobody listens. That's not true, right?
Well, it's actually a smaller audience, and I'm actually very proud of that smaller audience because they're extremely loyal, number one. And my ROI with that small audience is just crazy. So I'm very proud of the people that listen to the Medicare Nation podcast. It is growing slowly over time because senior citizens are obviously getting more adept at using their smartphones, and they're getting introduced to podcasting. And once they find it, they love it because it just changes their entire world.
Well, it means they don't have to wait around and tune into a radio show when it's live. They can tune in whenever they want. So why wouldn't they like it, right?
Oh, they love it. Well, once I sit down and explain to them, hey, you want to look up a show about quilting or, gardening? They're like, oh my God, I could find out. Yeah, I'm like, get on there.
I love it. This is the thing. You started your podcast in 2015 and I started mine really earlier in that year. And we were setting it up the tail end of 2014. So it's the same timing. And everyone said that, you'll only have young people listening to your show. And our show was on 3D printing. That was our first show. And they said, you'll have the engineers and the young techies and that'll be it. And the amount of retirees we had was so high. And I was astounded by the age range of our listeners. And I thought, no, but they don't know what they're talking about. These podcast experts out there, they don't know what they're talking about. There's an audience for everything. And so actually one of the most successful shows I've interviewed a host from is the Not Old Better show. And his is focused on entirely a 50 plus audience. And he gets like 250,000 downloads. So, I mean, there's no way. There's an audience for what you do. So what made you decide to start this podcast though, seeing there were detractors?
Well, I only learned about podcasting in 2015. I had no idea what it was before that. And as a Medicare expert, my goal and my mission is to educate as many people as I can about Medicare. And I had published a book at the time called the Medicare Survival Guide. And I just thought that was going to be great that, people could search on the internet to find out about Medicare. They could find the book and get a resource. But then when I found out about podcasting and how I could just speak to everybody around the world about Medicare and whoever wanted to listen, I was like, that is my platform. So that's why I started it, so I could reach out to as many people that wanted to listen. I could talk as much as I wanted and they could listen and learn everything about Medicare.
Well, it's so smart because in a way, what's changed, it changes all the time. So you need something where you can't be waiting around to print a book on this. You've got to have something where you can be active and live because things change. I was spot listening to various ones of your episodes, and I picked one of the episodes where you talked about the 2 vaccines for shingles. And this is a hot topic among the aging community. My mom was just talking to me about some friend who got shingles and now she's all afraid of it. And so I sent her your episode immediately. I was like, well, there's one that has a higher percentage of effectiveness. I'm like, if your doctor says it, pick that one.
There you
so
go.
I learned something from, and I'm not in Medicare yet. So
there you go.
But there you go. I could support my mom in that. So that's really important. You probably get a lot of caregivers and a lot of people who are trying to figure out how to help their parents through this.
Well, I do. And it's so funny because in the beginning, when I first launched, I was trying to speak directly to people that were 65 and older, not understanding how small of percentage wise of an audience there was. And I had very small downloads in the beginning. And then I realized when I started doing some research that predominantly the major group of people that would be listening would be 35 to 54 years old, which make up 33% of the listeners on podcasts. So I said, those are my adult children of senior citizens. That's me. I said, and that's the sandwich generation. I said, oh my God, I'm going to talk to them now. So that's what I did. I started speaking to them as the people that had children themselves. They've got their parents also to make decisions and help them out with our typical sandwich generation. And that made a huge difference and propelled the podcast.
Oh, I love that when you find your audience. And this is something that I encourage my listeners to on the show all the time is that getting started, because sometimes we have an idea of what our audience is, but we could be wrong. And I found that out and you found that out. We could be wrong with who our audience is and who's really attracted to our show. We could learn so much more and then develop so much better books, programs, and other things that would support them.
I was totally wrong.
There you go. So what is some of the funny and things that, because you started your podcast early on and there wasn't as much support as there is today. So what are some funny things that happened when you were launching your show or when you first got started?
So the number one funny thing, and it still stands today, is that I'm technology challenged. And I know really seriously, I had to have one of my good friends literally show me how to turn on the microphone. So I just wanted to speak. I'm the Medicare expert. I could talk all day about Medicare. So just let me talk, but somebody else do whatever else has to be done with the podcast. So I literally outsourced everything on the technology side. And I was eating peanut butter and jelly sandwiches for 6 months because I couldn't do anything. So that was kind of very stressful and frustrating. But then I slowly started taking things back. I started writing my own show notes. And then I had one of my good friends from our Florida Podcasters Association start teaching me how to edit a little bit. And then I was slowly able to take everything back after about a year.
That's great. That's great. I love it. So you got yourself educated over time. That works, but you were still starting, which is so different from so many other people. So you've been podcasting since 2015, but you have almost 100 episodes? Have you reached 100?
That's correct. Yeah, I'm just almost at 100 episodes. Yep.
So do you have something big planned for 100?
Nope, not at all. I'm not worried about the episode number. I worry about my content and the quality of the content. Lucky for me, it's coming up, which is the Medicare annual enrollment season, which starts in October. So I'll have plenty of excellent content for the changes that'll be coming for them in 2020. So I'll easily surpass 100 and beyond going through December.
Yeah, you've got a lot of information to start talking about.
I've got a lot, yeah.
That's great. So what advice do you have for someone who wants to start out?
Well, whether it's a hobby or it's related to their business, they really feel they have something they want to share, they should share it. They should get out there and start the podcast. Do not wait until you feel like it has to be perfect and it has to sound great and everything. Just do like I did. I just said, I want to talk. I have a great message. I want to get it out there. And I urge everybody to start. You'll learn from your mistakes and you'll just get better and better as you move along. So just get it started, get your important message out there. You'll be so happy that you did, and you'll start learning more, and whatever else you need, you'll pick it up along the way.
Absolutely. So this is a spot where I like to ask 5 questions. And so this is on the best ways to be successful podcasting. And so what are some of the best ways you found to book great guests?
Because I have such a unique show, it was really weird that there weren't many podcasts that were actually entertaining my type of guests at the time, who were experts in Medicare or some of those national associations for diseases like the American Heart Association, the National Diabetes Association, Lung Association, things like that. So I actually, like I told you, I outsourced everything. So I actually hired Interview Connections with Jessica Rhodes in the beginning for the first 3 months just to get me started, because she was like, I have no idea who these people are that you want for this podcast. It was really difficult. So her and her fantastic team helped me out right from the beginning. And once we got a couple on, and because I was, very expert in my knowledge and easy to communicate as an interviewer, very conversational, just like you and I are doing here, Tracy, people actually started reaching out to me in emails very quickly. So people wanted to be on the show. They had a lot of things they wanted to share, and it just started building up very quickly.
So interesting. That's a wonderful way to get started. But how have been some ways that you've helped yourself increase listeners?
But to increase for listenership, it's really important that you stay engaged on social media. You've got to let people know what you're doing, because you never know. And the famous thing is you never know who's listening. So it's the same thing with social media. You never know who you're engaging with. You could just be putting out tweets and Facebook posts and LinkedIn articles and things like that. And all of a sudden you could get, responses from people, and you're like, wow. Like I had Kevin Harrington was one of my guests, and, we talked about what can seniors do if they're deciding they'd like to get into a second career, start a new business, and him being a famous shark and, being famous for his infomercials. He was just an excellent guest to have. And him, from seeing my social media and through friends and other, associates that I've been in the Tampa area, we got connected, and it was just great having him on. So just stay engaged with your social media.
That's wonderful. I've had him on a couple of times because I've written some articles about him. He has such a broad background. So yeah, great guest for you. So what are also some ways, now that you've taken over the show and done it yourself, that you've managed to produce in a professional way?
Okay, I don't know how professional it is, but I just do the bare minimum that I have to do, that I know it's going to be right. I don't do anything exorbitant. I don't stress over it. It's pretty unique. I just want to get great content out there. I just want people to be able to hear it and listen to it, as clear as I can, and then just get it out there.
Yeah. So sound clarity is important, but other than that, you don't worry about it.
I'm telling you, I got to do as little as possible. I'm like the perfect person. I could be a case study for all the newbies out there who are so worried about the technology and all the software and all the gear. I still use the most simplest gear. I'm still using my ATR 2100.
I'm so glad to hear it.
Yeah, I am. It's a great microphone. It does its thing. I'm scared to change over equipment because I know what I'm doing now with what I got.
Oh, don't change. I'm going to tell you this right now. My partner, Tom, did a study on all microphones. And the microphone that you've chosen, the ATR 2100, we use a 2005, but it's a similar version. It's just a little bit more pro version. But I've had mine forever, and it still has the best sound with the least amount of work on the editing side. Because it doesn't pick up environmental sound around you as easily. So your sound is clearer. And so it makes less work, less time involved in editing. So by buying a less expensive microphone, interestingly, you've made it easier for you on editing.
And that's what I'm all about, Tracy. Simple and just get the job done. That's all I want to do.
So now, you talked a little bit about engagement, but do you encourage engagement in your community? Did you encourage them to ask questions? How do you do that?
Yeah, on the show, I tell my sandwich generation, the big thing I tell them is, hey, get over to your parents and show them how to get on Medicare Nation, because number one, it's going to change their life once they learn about podcasts. But more importantly, it's going to give you more time back for yourself and for your own family, because now they're going to not have to ask you a million questions about Medicare and their Medicare plans. By listening to the show, I've got almost 100 shows. It's everything about Medicare on there. Everything they want to know can be answered by listening to Medicare Nation. So I always have a call to action to have them show their parents how to get on Medicare Nation and then to help them search for other podcasts.
Interesting. I love that. So you're getting two listeners. I love that. So you're increasing listeners and encouraging engagement at the same time. I love it.
I want all podcasters, they can all thank me when we meet at Sheep Podcast because I'm totally like raising the bar for all the people that are over 60 years old. They're listening probably to everybody's podcast now.
Yeah, they're getting excited. Thank you. So actually, I was just about to talk about, you're going to be on a panel on monetization at the Chic podcast event in October. That's how we got connected, and I'm excited to see you there. But what are some of the best ways you found to monetize it?
Even for veterans in the industry, they still believe like sponsorships is like the way to go. And that is so not true. There are so many creative ways to monetize with a podcast. And people don't realize if you get something that you're not paying for, that is also a way that you're absolutely making money because you're not paying for it. So that's one way to get out. Because I have 3 podcasts now, Tracy. I'm just got so much time on my hands that all I want to do is podcast for the rest of my life. But in one of those shows, I rate and review different restaurants and I rate and review different activities in the Tampa Bay area. And many of the times I will get that at no cost because I need to do the different activities and that doesn't cost me anything. So I'm actually doing something for free and rating them based on my experience, a truthful experience. And that saves me a lot of money doing it that way.
What's your show called?
That show is called Weight Loss Nation.
Oh, okay. And what's the other one?
And the third one, which literally just launched last week, again, is tied again to my seniors. And this is as geo-niche as you could get, literally doing a podcast on a 55 plus senior community here in Florida that's called Sun City Center, Florida. It's called Sun City Retirement Life. It's literally about the actual community here in Sun City Center. And I talk about the different clubs and the activities and the real estate and the community and everything that goes on here in Sun City Center, Florida.
So, you know what? You're the second one that I've interviewed on for these Authority Magazine articles that has worked on a hyper local level. I love it because you're covering that, but you're also going to be putting out a lot of information that's drawing your audience right back to your Medicare Nation. So,
isn't that amazing?
I know. Yes, you've got it all going together. I love it. That's so good.
To answer your question again, well, that's again how people can do that is by cross podcasting. So whether it's your own podcast, okay, which of course I'm going to mention on Medicare Nation that they start listening to Sun City Retirement Life by going on other podcasts. That being a guest on another podcast and helping both podcasts bring their audience together is actually an excellent way to help increase your listenership. So that's a very good way to do that.
Yeah. So has your position as a podcast host really increased your authority in the industry, given you speaking opportunities, other things? What has it led to for you?
So the first thing that I'm going to say is that if you are an authority in a niche, you should definitely be blogging or publish an ebook or a traditional book. Okay, so when I published my book on Medicare, that immediately opened every door. I do speaking now all over the nation in regards to Medicare, not just at podcast conferences. I go to many, many conferences about aging and different conferences with regards to Medicare. So it has totally opened that door. I am now, recognized as one of the top experts in the country. So publishing something, whether it's an article, a magazine or on an internet site, on your own blog post, getting interviewed in the paper, publishing an ebook on your topic or an actual book will absolutely start that. And then with the podcast also, I mean, that just totally just like killed it now because now they listen to the show. I'm almost 100 episodes in. I've had unbelievable guests on the show. My knowledge content is insane. How much I know about Medicare. I think that's probably kind of crazy, but I do. I know a lot.
No, it's really obvious when you listen to the show, though, how deep your knowledge is, which is so wonderful. And because you know what the difference is that there's a lot of people who do shows that are in a niche like that. And you can see clearly that they've wrote a script, they've made notes, like whether they're in social media expertise or whatever it might be. And you don't do that. You are just talking off the cuff. Your knowledge is deep. I'm sure you have a little bit of notes in front of you, but you're not following them. You're talking straight from your heart and straight from your knowledge base.
No, I'm happy to hear that. Thank you. I never have notes. It's either if I do, it's a bullet point for something that I don't have much knowledge in. Usually when I already decide for
Or
the
some
next.
stat you don't want to forget,
Yep,
right?
that's it. That's it.
Yeah.
Otherwise, I'm sitting here talking with my hands right now. That's exactly what I do when I'm.
Me too. You and me both. It's very common that I usually hit the mic at some point. So
Yeah, everybody say it's the Italian thing, but I'm like a mutt. I got so many different nationalities.
me too, but I do have a lot of Italian in me too. So that's what it is. So it sounds like your show is really a binge listenable show though. So when somebody finds it, they need all this deep knowledge and information on Medicare. And so have you found that to be the case? And what do you think makes you special and really stand out from other shows that are about healthcare and retiring and things like that?
Well, number one, in 2015, I was the only show that was about Medicare in the whole country. And my friends used to laugh about that also. So, but now there's probably about a half a dozen. And most of those podcasters have additional tasks or in their occupation. So they might be a general insurance agent that offers other kinds of insurance in addition to Medicare.
Right.
Or they might be a financial planner who usually handles people's retirement funds and tries to guide them towards retirement. And then they also do Medicare. The difference with me is that is all I do. I am a Medicare expert and I consult with people across the United States. And that's another way of how I've monetized the show is by asking people if they have any questions or they want to hire me as a consultant to assist them with their Medicare issues, file grievances, appeals. And as soon as I started asking, the emails started coming in.
So you're actually starting a new program, right? So you're starting a new program that's for insurance agents.
Oh, yes, I am. That's correct. I am. And in the fall, like I said, the Medicare season starts from October 15th to December 7th. So I'm actually starting a program to help Medicare agents that are in the same position that I was, where I was totally broke and didn't know what the heck I was doing.
Oh, no.
Yeah, I mean, we're all there, but I want to help them now to realize how they can overcome all the obstacles of sales and being in a commission-based business, not getting a paycheck or benefits, and what to do about it so that they can learn how to serve their clients from their heart and they can work less hours but still make more money and then have plenty of time for their family by making six figures and beyond. So it's going to be called the Kick-Ass Get Ready for AEP program that's starting September 18th. So if any insurance agents out there would like to have a conversation and learn more about that, they could certainly contact.
Well, you know what? That's so important though, because when you're in a group that is in a community or a career that there are so many of them, like I go to this event in LA and what I found was that there was like so many wealth builders that they call it, like wealth managers and like they're all the same. And you're like, how do I know the difference? How do I understand who has deep knowledge? How do I understand I'm with the right person, right? And so if you can't build a one-on-one relationship with people, that's just not physically possible. You've got to find a different way to go about it. And you've got a great formula here. So wonderful. So now, are you everywhere at Diane Daniels or are you Medicare Nation everywhere on social and other places?
I am on both. It's always hard when are you trying to brand the business name? Are you trying to be a Nike or, are you trying to be a Diane Daniels, right? So you look at some of our famous podcasters, you look at John Lee Dumas, right? With Entrepreneurs on Fire. So he, you say Entrepreneurs on Fire, it's JLD, but then he can promote himself as JLD too. So that's what I'm trying to follow because Medicare Nation is such a great name. There's no confusion. Okay. Everybody knows what the show's about. There's no worries there. And I want them to know that I'm the expert. So when I'm talking and speaking, it's always going to be Diane Daniels. And then when we're going to be bringing in the show and that type of media, it'll be Medicare Nation.
Wonderful. I love that strategy for you. Is there a really big guest, a big get that you'd like to have that maybe they might listen to the show or read the article and we might be able to connect you up with them?
Absolutely. I want Betty. On my show.
Really?
Yeah.
So why?
Oh my God, she's like one of the best actresses. She's hysterical and I just love her to death.
I mean, who doesn't love Betty White, right? I mean, who that generation respects her, the younger generation respects her. So
everybody respects Betty
you're
White.
right. She'd be a great get.
Absolutely. You know, she's a senior and she doesn't act like one. She doesn't look right. She doesn't act right. She's just an absolutely wonderful human being. I'm sure she has some wonderful stories or some insight that she could help my listeners by her being on the show. So she is definitely the one person I would love to have on the show.
Well, let's see if we can make that happen.
Awesome.
That's right. Wonderful. Well, do you have any last bit of advice for anyone starting out or anyone who wants to grow their show more?
So number one, they've got to be passionate about their subject matter. Really, people should not be going into podcasting with the foremost thought that they're going to be making money. It should be because you have a message that you want to give to your audience, your specific avatar, and you get on there and start speaking and delivering your message. When you have a passion and you love what you're doing, everything else is going to follow. It's just going to happen. But if you go in there and you think you're going to be making money, okay, and this is going to be your answer and it's going to be your $1 million trick here, it's not going to work. And I'm not saying it's not for everybody. Of course, somebody, accidentally slips into something and it could happen for them. But for the majority of people, if you go in right from the beginning thinking you're doing this to make money, you're setting yourself up to fail.
Oh, thank you, Diane. That's such great advice. I love it. So Medicare Nation, Weight Loss Nation, Sun City Retirement Life, those 3 shows. Diane Daniels, thank you for being a center of influence in podcasting. I really appreciate it. And I can't wait to catch up with you at this She Podcast event. Maybe we'll have coffee or a drink or something together.
We absolutely have to have a drink together, Tracy. And I'm sure you'll be devastated that you decided to do that, but we're going to do it. I'm telling you, we're going to do it.
I look forward to it. I absolutely do. So Feed Your Branders, this is Center of Influence. I'm going to keep bringing you back new podcasters with great ideas, podcasters who've been successful, who can give you some great advice on how to grow your shows. And that's our goal with this. And of course, there's also regular Feed Your Brand episodes where we're bringing you tactics and tips and ideas and things information in the industry that you may want to know about. Like you don't want to miss the upcoming episode or the past episode, because this will have aired after that, the episode on the new category changes in iTunes. So we're always bringing you technical things, but if you're managing your own show, these are definitely things you need to take a listen to. So trying to bring you both at the same time. And of course, you can always follow all the write-ups for everyone who I feature on Center of Influence in Authority Magazine. There are links to all of those at our blog posts and website, feedyourbrand.co. So thanks everyone for listening. This is Tracy Hazard on Feed Your Brand.
You've been listening to the Binge Factor podcast. For more information on podcasting and videocasting success tips and tactics, please go to thebingefactor.com. And be sure to listen to our other show for podcasters called Feed Your Brand. If you'd like to be interviewed on this show, as well as featured in Tracy's column, please go to thebingefactor.com/guest and apply.